Welcome back, friends. So in this short video series, that is tricks of trade in HPB surgery, this is second part, and in this video we are going to demonstrate how to apply the Pringle maneuver, and this will be live demonstration, and we will also discuss a landmark paper by Sir Calvien, that is protective effects of ischemic preconditioning for liver resection performed under inflow occlusion in humans. So this is going to be a good video, so stay tuned till the end of this video. So friends, we have modified the basically Pringle maneuver and we are using Foley's catheter. Other technique is to use the soft vascular clamp. So we will also demonstrate that in some other video, but you will find that this Foley's technique is one of the best technique and least traumatic. So this may be a good addition to your armamentarium while dealing with the liver surgery, maybe in an elective setting or in trauma setting. This was a case of giant hemangioma liver in which we did a liver resection, and this was an exophytic hemangioma almost occupying the whole of the right lobe of liver, and patient was symptomatic with pain. So we did enucleation and partial enucleation and partial resection of the liver. The quick recap, friends. So in the first part in this series, we have already discussed the theoretical part, and we have already talked in detail about the Pringle maneuver, the total vascular occlusion, that is the Heaney Manoeuver in case of liver resection or liver injury, and we also discussed the basically theoretical rationale. We also discussed the landmark paper by Sir Pringle, and another paper was to examine the maximum occlusion time, that was 120 minutes given in this paper by Quine et al. And we have already shared these papers in our official Telegram group. So friends, this first part is available as a free bonus content on our app, means that anybody can watch it after downloading our app. The app is available for iOS and Android. The link for same is given in the description of this video. So do download our app and basically for a better learning experience, get connected with us on that platform too. So coming to the part 2, friends. So as I said, in this part we are going to talk about the ischemic preconditioning of the liver. That the concept was basically given by Sir Calvien in landmark paper, and live demonstration of the Pringle, how to apply a Pringle. So as I said, this was a case of giant hemangioma in 45-year-old lady. So we did hepatic resection and partial enucleation. So friends, this concept of ischemic preconditioning of the liver is a very interesting concept, and I hope all of you are already aware. If not aware, please stay tuned as we discuss the relevant details of this paper. So basically, ischemic preconditioning is a short period of ischemia followed by reperfusion before we apply a sustained ischemic insult. Having said so means that before we start actually resecting the liver, we expose the liver for a ischemia so that liver get sensitized. So in the same study by Calvien et al., they have given a reference to their previous study that they conducted this ischemic preconditioning study in rodents, in which they did 10 minutes of ischemia followed by 15 minutes of reperfusion, and after that they basically applied a sustained sustained hepatodural clamp for 75 minutes, and still there was a survival. So basically that was the prequel of this video, that they have conducted a prequel of this paper, that they conducted a study in rodents and in which they study the beneficial effect of ischemic preconditioning. Objective of this study was whether ischemic preconditioning protects human liver against subsequent period of ischemia in patient undergoing hemihepatectomy, and to identify possible underlying protective mechanism of ischemic preconditioning such as inhibitors of hepatocellular apoptosis. The summary background I have already discussed. So in this study, they applied a 10 minutes of portal clamp, Pringle Manoeuvre, followed by 10 minutes of reperfusion. Or in the other group, there was no ischemic preconditioning, that was the control group, and followed by lever section. So please understand that they did ischemic preconditioning before starting the lever section or before applying the sustained this Pringle Manoeuvre. So there were total 24 patients in this group, in which they either went into right or left hemihepatectomy, and alternatively they divided the patient into ischemic preconditioning versus direct lever resection. Again, in this study, they applied a prolonged Pringle clamp that was 30 minutes, and during which they didn't release the clamp. It was a prolonged ischemia, and the rationale behind it was that prolonged Pringle, that intermittent Pringle, in which we apply Pringle for 15 minutes and then release for 5 minutes, lead to more blood loss. And basically prolonged, the concept behind is that prolonged Pringle for 30 minutes and doing the hepatectomy during those 30 minutes reduced the blood loss and had a better post-operative outcome. In the analysis, they have given that the serum levels of aspartate transferase and alanine transferase were reduced more than twofold in ischemic preconditioning patients, and the benefits was more while we were having a marginal lever, like there was steatohepatosis. So there was a higher benefit, and these patients had a better outcome. So friends, this ischemic preconditioning is a beautiful concept, and I wish that you should incorporate this technique into your armamentarium while dealing with the lever section, maybe that is an elective setting or in trauma setting. And friends, I have already shared this link to this article in our official Telegram group. So do get connected with us on our Telegram group also, and where we send all the updates and have a better learning experience. And also friends, if you are watching this video on YouTube as a free video, then you may not be able to watch the whole video, as everything we cannot provide as a free content. We have to generate some revenue to sustain this initiative, and if you want to watch it as a free video only, then please wait. We will unlock the whole video in due course of time. And for early premium access, please download the app or join the channel membership and enjoy all the perks and privilege of being a member or on our app. The link for app, which is available for iOS and Android, and link for the Telegram I have given in the description of this video. So do download the app and get connected with us. So this is here you can see there is a large hemangioma, which is more of an exophatic component, and it was basically occupying almost the segment 6 and 7 and part of the segment 5 and 8 also. So in this part of video, we are doing as a preparing for the lever section. We are doing this cholecystectomy, friends. And as I said, we will demonstrate this modified technique of Pringle with the help of Foley's catheter. And here we have already delineated the porta hepatis. The finger is